This is Eric Saviano with Enroll Nebraska. Our webinar for today, we are going to be talking about open enrollment, how we have done so far, how we're going to end even stronger than we're going to continue talking about the Affordable Care Act and exemptions related to having the health insurance that the Affordable Care Act requires. And then we're going to talk about care stories and the importance of collecting those stories in our effort to maintain the health coverage that we currently have in our country. So that's some basics. I'm going to just show you my pretty face. This is, I am the statewide coordinator with Enroll Nebraska, which is a coalition led by Nebraska Appleseed. And that is me. And like I said, we're going to talk basically about the Affordable Care Act, where we're going as we go forward. I'll direct you to, as usual, our Enrollment/EEG website, where you can download all of the important, all of the slides that you're seeing in front of you, and also see all of the resources that we're going to be throwing at you. There's going to be quite a few throughout this one. It's a little complicated. Be sure to check them out and download them as you see them come up on the screen so you can follow along with us. You'll also notice there's a chat box to your lower right hand in your the lower right hand corner of your screen. We're going to be monitoring that for questions as they come in. I'm going to say hello in there right now. Hello. And feel free to chat to the presenters as we go through. We're going to have 3 today, including myself. Put questions and answers in there as they come up, and we will have a specific time for questions at the end of our presentation. Okay, I guess I'll also say sometimes we have technical glitches with this stuff, and that can be frustrating. Prepare for that if you'd like to, by knowing that you can usually reload and get information that way. Oh, and somebody's already telling us about a glitch that we're having. So audio is repeating with Candy. Is anybody else having the same problem? Check that really quickly. Anybody else having repeating audio problems? Okay. Thanks for the feedback. Some folks are good, some are not. Maybe this is one of those chances to are doing fairly well. Good. Okay, thanks for the feedback. And Candy, we have had experiences like this. Feel free to just reload, try to sign out, sign back in. This also will be recorded and saved at enrollnebraska.org/EEG, where you found the webinar materials as well. Okay, so we're going to jump right in and talk a little bit about who we are and what we do in our state. Many of you know this. We are a statewide network of community organizations, enrollment assisters, healthcare providers, and advocacy groups. That basically means that we are working to coordinate community members, staff members at health centers and community action agencies and other organizations to make sure more people are enrolled in the Affordable Care Act. There's into enrollment, and we have gained enrollment each year, and that trend has continued so far this year to enroll more people than we ever had. We are found on the web at enrollnebraska.org, and that is your location for resources, to very advanced webinars such as the ones we're recording right now. On Facebook and on Twitter, we're also present, which can help spread the word in one of the easiest ways we do. This group is particularly important for us to get the word out to people who may not know about us. It is comprised of local churches, local schools, nonprofit organizations not directly related to healthcare, some nonprofits that are directly related to healthcare but don't have enrollment assisters, hospitals, other all around the state, just who are interested in helping get more people enrolled. And that is a noble goal and one that lots of folks don't see the benefits of directly at your organization, but one that can change a person's life. So we think this is a low commitment for you as nonprofit or other organization leaders, but one that really can make a huge difference in people's lives. High impact is one way I like to say it. So let's look at the numbers. So a report was released yesterday about how we've done so far this year. And it looks like we are still trending ahead of last year. We are at 8.8 million people enrolled nationally, just within the states, which we are one of. And that's up from 8.6 last year, which is great. Nebraska, we've continued to go up as well. Now within about 1,000 of our total last year. So we are most likely going to overshoot what we got last year. We're currently around 87,000 in Nebraska, and that's still, at this time, 8% over last year. So if you're a numbers person like I am and like to see some of that on paper, this is good information for you to have. The last report, there will be one more report from CMS, most likely, that will come out at the end of open enrollment, and we'll see a lot more of these numbers broken down by county and new and renewed folks and active renewals and all the stuff that will help guide our outreach efforts for next year. I also want to mention our Enroll Nebraska Maze Race enrollment campaign. We have in enrolling over 2,017 folks. That was our goal between November 1st and December 15th. We successfully enrolled 2,204 individuals in Medicaid or the marketplace through our enrollment assister network. And that's with 16 organizations participating and probably around 80 individuals helping enroll people. So that is those folks who are helping enroll the folks who need it the most. And that is a pretty great goal and a pretty great outcome for this statewide campaign. So woohoo on that. All right. I'm going to tell you a couple of more things about the end of open enrollment. I have 3 slides here that have some specific resources that you can take and you can use in your organizations to get more people enrolled, even though there's only 12 days left in open enrollment. We often know, well, we've studied, national organizations have learned that it takes at least 4 touches for the majority of people to get enrolled in coverage. And the efforts that we do and you do can make the difference in getting somebody on board with signing up. Woohoo, yeah. So thanks for chatting in the box there, Moo Moo and Ashley. Back to what I was just saying. So we want to help equip you with the resources you need to make one last push to get people enrolled this open enrollment period. And I'll just remind you, no matter what happens with the law in the near future, 2017 is guaranteed to take place. The contracts are in stone with these providers, and folks who sign up through healthcare.gov in Nebraska will have insurance in 2017, and that is something we can bank on. So, like I said, we have prepared a few documents that can help with your outreach and your push. There's a sample email that is very brief and gives some of the options and ways to get in touch with an enrollment assister or healthcare.gov. There are tweets, a couple of tweets that can go out through a website called Twitter. And if you don't have an account with that, it's pretty easy to sign up. And then another little known website called Facebook can share with your friends from past and present, or your organization can share with people who have quote unquote liked your organization through just simply pressing some buttons and sharing some images on there. I think it's pretty magical, and the folks in the room really do too. So it's something that you can do. It's one of those low commitment, high impact things you can do to get the word out. These are once again located at enrollnebraska.org/EEG. So take a look there, download it. I've kept it as a Word document, and you can just copy paste a lot of that stuff directly into things that you know. All right, and I just mentioned that there are consumers out there who probably have questions about the election and how it relates to enrolling in the Affordable Care Act and health insurance through it. Enroll Nebraska and Nebraska Appleseed put together this quick front and back page questions related to enrollment after the election, post-election Q&A. It is up to date as of now. We are looking at changes possible in the near future, and we are the location where you can get information about what changes are there without a lot of the rhetoric and stuff you see in the news. So this is another form that you can keep on hand if you do have questions from people about why it is still important to enroll and what we do know versus what we about. This is the document that you need to keep close. And finally, Enroll America has equipped us with a few shareables about getting enrolled before January 31st. Enroll America is a great partner of ours and has been for years and years, and they are always looking to make it easier on us and our advocate partners. So there's English and Spanish for our 2017 open enrollment is here. One only in English, a little more streamlined with some hashtags. Covered America at the bottom. So Enroll America and Get Covered America organization, a couple different brandings. Okay, those are available at enrollnebraska.org/EEG. That is a great website. I'm going to just type it in this. enrollnebraska.org/EEG. That is an important website for you to remember, folks on this call. Okay, with that, I wanted to, if anybody else has thoughts on last minute things you can do to get the word out, feel free to chat those in the box and we'll look at those while we continue in our webinar. Our next speaker is going to be sharing about the exemptions that are related to having coverage in the Affordable Care Act. Folks should know that there's them and they can be complicated. So some resources for you to slide. But Molly's going to walk through some of that information with you as well. Okay. Molly?
Hi, everybody. I'm Molly McCleary. I'm the staff attorney here at Appleseed in the Healthcare Access Program. And we're going to just go over to the disability payment or individual mandate or penalty, whatever you want to call it. We're going to go through pretty quickly, even though it's a big topic because we have quite a few things to cover today. But yeah, let's dig in. So before we get started, this is pretty complicated stuff. It's a lot of different actions based on different person's circumstances, and I don't know about you, but every time anything with taxes or filing taxes or anything like that gets involved, I think people start getting a little nervous, and so I think it's okay that we admit before we get started that this is a complicated topic, and the intent of this webinar is really just to give kind of a broad general overview around the rules for exemptions. If you have specific questions about a particular client or personal tax situation, it's not the best to ask them on the webinar. And in the chat box. I won't be able to fully answer it, but feel free to email me after, or tax professionals like CPAs or folks that do tax prep services might be able to help with some of the tax questions. So anyway, what we'll discuss today is the shared responsibility payment or the tax penalty, the two types of exemptions, which are marketplace exemptions and then IRS or tax form exemptions, and then some resources that will be helpful as thinking through this tax implications of insurance. So first, the shared responsibility payment or tax penalty or individual mandate, it gets called all these different things, but it's the same thing. A person must have minimum essential coverage or an exemption in order to avoid paying a penalty for the months that they're uninsured. Minimum essential coverage is describing what plans have to cover. They have to cover certain things in order to be considered minimum essential coverage. So they have to cover the 10 essential health benefits, which are sort of the service array that every plan on the marketplace has to provide. And then it includes, for the most part, Medicaid, Medicare, and employer coverage would meet these meet the minimum essential coverage requirement. The penalty is assessed based on the months that you're not covered. So each month that you're uninsured, it's essentially 1/12 of the overall penalty, and we'll talk through what the numbers look like. So in other words, you're only penalized for the months where you don't have insurance. So it's a prorated penalty based on the months that you're uninsured. The other thing to note is that sometimes folks have questions about when they actually pay the penalty, and that is on the federal tax return at tax time. So we will then talk about what the penalty actually looks like. So for this year, it's 2.5% of household income above the tax filing threshold, or $695 per adult, $327.50 per child, up to $2085. So there's a calculation of which of these two bullet points would end up with a higher penalty, and then the higher penalty is the one that's imposed. So this is, again, sort of complicated with that 2.5% of income above the tax filing threshold. So you have to look at what the tax filing threshold is and then 2.5% above that. In 2017, it actually, the slide is not correct, but 2017 is actually the same as 2016 in terms of the penalty. And then future years would be a flat penalty amount, similar to that $695, but indexed based on a cost of living adjustment. As I mentioned, these are the penalty for the months that you're not insured. So these are the full, like if you were uninsured for the full year, this would be the amount of the penalty. If you have short gaps in coverage, which is defined as less than 3 months, or 3 months continue, or a short gap in coverage is less than 3 consecutive months uninsured. If you have, so for example, if you got a job, or if you left a job, had a month, got another job, you would be uninsured for that month, but that's a short gap in coverage, so you wouldn't have to pay the penalty just for that. So there are some kind of ins and outs questions that have to be asked about the length that someone went without coverage, the type of coverage that they have, in order to determine this penalty. If you are below the tax filing threshold, you don't have to pay a penalty. You are exempt because if you can't pay taxes, you can't pay a tax penalty. And I think that is pretty much the main things to know about the amount of the penalty. To avoid paying the penalty, you have to have an exemption. There are different kinds of exemptions that are based on different personal circumstances that a person may have during their year. Depending on the type of exemption, the exemption is claimed differently. So there are some that are claimed, they're IRS exemptions, which means they're claimed on your tax form at the time of tax filing. There are others that you have to go through the marketplace, get documentation that you have an exemption. And then there are some that you can do either way. We'll walk through specifically the different types of exemptions and whether they are marketplace exemptions or IRS or tax filing exemptions. Even though you have these marketplace exemptions, all exemptions have to be claimed on your taxes when you're filed. The marketplace exemptions just require you to claim this or to get this extra documentation. So it seems a little bit duplicative, but marketplace exemptions, there is sort of that extra step of going there, getting the documentation, and then including that on tax forms when you're filing. So the types of exemptions include hardship, which includes the Medicaid gap. If you live in a state like Nebraska, you qualify for a hardship exemption. Hardship exemptions also include things like domestic violence, periods of homelessness, natural disaster that resulted in significant property damage. Another exemption is if insurance is unaffordable. So if you cannot get a plan that this plan is more than 8.05% of your income, insurance is considered unaffordable, and so you can have an exemption from having insurance. Certain religious sects or organizations object to having health insurance, and so if you're a member of one of those, you can get an exemption. Like I mentioned, if your income is below the tax filing threshold, you don't have to, you wouldn't be assessed a tax penalty. Certain non-citizens, so individuals who aren't U.S. citizens, U.S. nationals, or lawful permanent residents who aren't, who may be citizens that are living abroad, or people who are not lawfully present in the U.S., including, even though DACA youth technically are lawfully present, they're in this category as well. So you can get an exemption if you non-citizen categories. As I mentioned, short gaps in coverage are less than 3 consecutive months. So if you have, less than 3 consecutive months, then you don't have to pay the penalty for that time that you're uninsured. If you have, say, 2 periods of uninsurance throughout the year, so say you were uninsured in January and then you were uninsured again in November, then you are only allowed to claim the first short period that a less than 3 consecutive months short gap in coverage exception. So you'd have to pay for that second, or pay a penalty for that second period of uninsurance. It's also worth noting that if you're covered for 1 day of the month, you're covered for the whole month. So this goes back to what I was saying earlier about how this is really a question of facts in that person's particular situation. What days of the month they're covered, how many months out of the year that they're covered, did they have consecutive coverage, or did they have gaps that weren't consecutive, things like that. Incarceration is also an exemption. This is for folks who are in corrections facilities after conviction. If you're in jail awaiting trial, it's not an exemption. Members of certain health sharing ministries are exempt, and then also enrolled members in tribes. So those are the overall list of exemptions, and then I'll break them down between marketplace exemptions and tax filing. So marketplace exemptions, as I mentioned, you have to apply for this exemption through the marketplace to get that extra documentation, which is an exemption certificate number, an ECN. This ECN is what you end up entering on your tax form if you are granted the exemption. It's important to note that marketplace exemptions take a little time to process. So it's not an immediate result get approved or denied an exemption, there is a little bit of a time lag. And so I know many folks procrastinate doing their taxes, and so it's important to do the marketplace exemption as soon as you can. Different types of marketplace exemptions include hardship, which includes the Medicaid gap, the unaffordable insurance exemption, membership in a religious sect, Indian tribe membership, incarceration, or membership in a health sharing ministry. The three there that have asterisks are ones that can be claimed at either time, either through the IRS exemption at tax time or on the marketplace.
Tax preparers might not.
Yeah. Yeah, so we'll talk specifically here about marketplace exemptions around the Medicaid gap. So in a state like Nebraska where there is no Medicaid expansion and you therefore don't qualify for Medicaid and don't qualify for subsidies under the ACA, you could qualify for a hardship exemption. If you're a resident of a non-expansion state at any time during the year, you are considered to be exempt. So that is to say you don't have to be a resident of a non-expansion state the whole year. So you could live in Iowa 6 months of the year for the first 6 months and then move to Nebraska for work, and you lived in Nebraska for 6 months, you are technically a resident of a state that didn't expand Medicaid. These are folks whose income is below 138% of the federal poverty level. So there are three sort of scenarios through when you're doing this marketplace exemption for folks in the Medicaid gap. This is one that we see a lot after the fact. We see a lot of people call us in like May or June when they've realized that like, oh, I should have claimed an exemption, but I've already filed my taxes and my tax preparer didn't tell me that there was an exemption. So this is really important to remember before you go file your taxes that this exists. So there are three sort of scenarios, as I mentioned. You can go to healthcare.gov and be determined ineligible for Medicaid. Income is below 100% of the federal poverty level, you get an automatic exemption. Person goes to healthcare.gov, applies for Medicaid, and is denied, but their income is between 100 and 138, they have to apply for an exemption. So they apply for the exemption, get the ECN number, and then put that on their tax form. If you go through your state Medicaid agency, so if you went through Access Nebraska, applied for Medicaid, and was denied, then you have to apply for an exemption. So three different sort of ways that you can enter the system, or I guess two different ways, but different income circumstances that path being followed to get that exemption and be able to claim that. So the last thing we'll talk about is tax filing or IRS exemptions. So these are ones that you claim directly on your tax form, which is Form 8965, when you file your taxes. You don't need to go through the marketplace and get that extra documentation or ECN to note on your taxes. You can just do it at tax time. The different ones that are granted at tax filing are if your income is below the filing threshold, if insurance is unaffordable, the certain non-citizens exemption, short coverage gaps, resident of a state that didn't expand Medicaid. So that one is where you might have that auto exemption if your income is below 100%. Being an enrolled member of a tribe, incarceration, or a health sharing ministry. So again, the ones with asterisks, you can note that they are both tax filing or IRS exemptions and also marketplace exemptions. So, yep, this is what I just said. And that coverage gap one is you have to get that ECN except for the case where you get that auto exemption for being below 100%. So this is very complicated and, like I said, very fact dependent on the client that you may be encountering. And so having all these rules in your head is kind of hard. So we pulled together quite a few resources that are linked in the slide deck, I believe, and then also available on enrollnebraska.org/EEG. These specifically around exemptions, there's a great webinar from a Center on Budget and Policy Priorities that walks through a bunch of hypotheticals around exemptions. And so they go through, this household is in this situation, this happened throughout the year, how do we get them exemption? Are they eligible or not? Families USA has this types of exemptions health insurance document that's a table.
It's on the next slide.
Yeah, it's on the next slide. And then they also have this understanding the requirement to have health insurance document. So we'll go to the next slide. This is the chart that I was mentioning, and it's really helpful. And that's all I have. So if you have any questions about exemptions, feel free to chat them in the box, or we'll have some time at the end.
Thanks, Molly. And folks, if you have questions, once again, put them in the chat box. We realize that we are talking above some folks' head and below some folks' head, if you can say that. But we feel like this is a good middle ground for folks, a base of knowledge that might help you understand your clients and the people in your networks a little better. So feel free to ask any questions you have. Hopefully these resources will be useful in the near future too. With that, I wanted to introduce our another person from Nebraska Appleseed, and who's going to talk to us more about story collection. So I'll turn it over to you, Kate.
Hi, everyone. I am Kate Mattson, and I'm the field organizer with Nebraska Appleseed's Healthcare Access Program. And for my job, I work a lot with probably some of the same people you all do, which is people who have enrolled in ACA plans or who fall into the Medicaid gap. And so I am going to talk a little bit about story collection and why it's especially important right now. So I know that the request for assisters to submit stories through the Enroll Nebraska website has been out there for a while. But in the past few months, the need to collect stories showing why the ACA is so important has become really time sensitive and just like essential in this moment. And so I'm sure you all know that Congress has laid the groundwork to begin the ACA repeal process. And so because those of us who have worked with people on the ground who've benefited from the ACA know that the law has worked for millions and millions of people who have gotten coverage through the marketplace or who also have pre-existing conditions or have been able to stay on their parents' insurance. We have stories to show that the law has worked and is important for people. So in this moment, sharing those stories with the right lawmakers is a really good way to try to have an impact on what they're doing at the federal level with the healthcare law. So one thing that we are doing at Appleseed is collecting stories that we are going to put in a big book that we're delivering to members of Congress when they are back in Nebraska at the end of February. So a link and online form that we've created to try to make collecting stories really easy. And this is different than the form that you all used for Enroll Nebraska. It's a form that gives us a release to share stories. It gives people the option to share photos. And it is, I think Eric's typing the link right now too, so you all can just click on it. It's nebraskaappleseed.org/myhealthcare. That's a really great place to send anyone that you are enrolling who would like to share their story with us. And honestly, sharing stories is like the best form of advocacy anyone can do right now. So if you all have people that are worried about their healthcare going away, who would like to share their stories, please send them to this link. I like to have a tab pulled up on my computer with the link up so that if I'm with someone who has a story to share, I can just turn my computer over to them and have them quickly submit it through our online form. So that is something to consider. So something that internally in our office, and I would encourage you all to do, is to set a goal for the number of stories that you think you can collect. We've encouraged every staff member to submit at least one, recognizing that many of us have ACA stories, even if we don't have a plan through the marketplace. So like for myself, I know that I have a couple of pre-existing conditions. And so the ACA has benefited me, even though I get insurance through Nebraska Appleseed. So I would encourage you all to think broadly about how people might be benefiting from the ACA. And you can take action sending out that link that we shared with people in your network, posting it on social media, asking other staff where you work to also share their stories. So give a little bit of thought to the number of stories you think you could collect, and that would be such a big help. Okay, I'll turn it over to Eric for this last piece.
Well, before we turn it over, I think we have these opportunities online so that we can hopefully motivate you all to do something next. And I think all of our interests and all of our jobs, all of our the people we work with have a stake in our healthcare at this point. So I want to really push folks to think hard about what they are going to do next and to make a commitment today to do something like that. It's not going to be something we follow up with you on. It's not going to be something we see posted publicly, but it is something that you can think about that we can commit to today in your own mind. So I'm going to start a poll, and you all should have it on your screens now. And I'd love to see what the number one thing you'd like to do to support the story collection effort will be. Like Kate said, the story, I mean, we need to think broadly about this as well. Some of the main, I know both of you in the room can rattle some of these issues off that have that affect everybody who are in small group plans as well as individual market plans. So if you want to say a few things, that'd be good.
Yeah, so I mentioned the pre-existing conditions. If you have something, anything ranging from having cancer to diabetes to a mental health condition, you've benefited from the ACA. If you are a woman, you've benefited from the ACA. If you are under 26 and able to stay on your parents' plans, you've benefited. If you can get prescription drug coverage, you've benefited. If you were able to get birth control for free or for cheap, you've benefited. Anything you'd add, Molly?
Yeah, so all plans are required to offer a certain venue of preventive services for free. So things like flu shots or annual wellness checks, those kinds of things would be stuff that comes from the ACA. Another one that's big is no out-of-pocket either lifetime or annual max limits, and so or no limits, I guess, on what the insurance company will cover. So I know in the past, a lot of times if someone got cancer or something that was a really expensive diagnosis, they would hit their annual or lifetime limit pretty quickly. So those don't exist anymore.
One more thing I will add is that most of the stories we've collected so far have been focused in the eastern part of the state. So especially for those working in other parts of the state, your help in collecting stories is huge. So thank you.
All right, I'm going to end the poll. Looks like we have a pretty even split of the next steps folks want to do, and I really appreciate you all committing to that in your own heads and on this poll to do something to take action on this. It does come up. We have gotten calls from reporters about this in the recent past, at least 5 that I know about in the last couple of weeks. so we can help direct people that way as well. A lot of enrollment assisters are on the call, and I know that folks have some concerns and have been expressing concerns about referring people to us, and I will what we do not consider this advocating when you do refer somebody over to us. This is just referring people to us, and the next step is that person's own. And so that is one thing that you can keep in mind as you are thinking through this. We have some resources for individual assisters if you want them to promote to folks who fall in the gap or who have benefited from the ACA, but I haven't included those in this slide deck. Feel free to email me if you'd like to. All right, so folks, we are wrapping up. This is our final couple slides. So we want you to post any questions that you have in the chat box related to the last push for social media, emails, outreach for the Affordable Care Act. There are 12 days left, and that is 12 days where we can hopefully enroll about 10,000 more people in the state. That will put us close to our goal of 100,000 that we set before we knew the results of the election or anything like that. Also, any questions you have about exemptions that Molly presented on, resources on that, feel free to use those resources. And any questions you have about story collection and some of this healthcare defense work that we are taking on as an Enroll Nebraska Coalition and at Nebraska Appleseed. So now is your chance to put those questions in the box. And if you're not tilting your head and looking like an owl, thinking of questions, I will remind folks that this webinar is recorded and will be posted at enrollnebraska.org/EEG, that special website that we all know and love. And we will also be continuing these webinars as the might take place. We are your source for this information and your trusted and non-rhetoric source for this stuff. So feel free to check back in with us. We will be sending emails. Anybody who's registered for these webinars is now on our email list. You can always opt out if you'd like to. But with that, I think we will close it down. Thanks, everybody, for being on the webinar today. And we look forward to talking with you in the near future. Thanks for working on those stories. Have a good day.